Western Equatoria State has a higher percentage of HIV cases compared to other states in South Sudan. Health experts estimate that HIV prevalence in antenatal clinics across the 10 states stood at 7.2%. A review of HIV data by officials in South Sudan suggests a consistently higher prevalence in Western Equatoria State than in other states. Monica Andrew, the acting chairperson of Western Equatoria State's HIV and AIDS Commission, says the number of HIV cases is alarming in Volo, Greater Mundri and Maridi counties. She blames ignorance among citizens about the disease, which she says could explain the spike in HIV and AIDS cases in Western Equatoria. Andrew is calling for the World Health Organization's intervention to slow the spread of the deadly disease in the state.
Because awareness total is not there. Well, those people, they're ignorant about HIV. Even Meridi, there's proper awareness. And Mundra West total, if you tested somebody positive for that issue, this become difficult for us, our Ministry of Health, our World Health Organization, to support us to fight the epidemic of HIV in South Sudan, particularly Western Equatoria. Western Equatoria need more awareness. I ask the World Health Organization or the partners in Western Equatoria to support us more with the awareness. Take the awareness is not only in the state, capital state, you need to go down in the county, in the Payam, to the village.
Andrew says the State HIV Commission, the State Ministry of Health and implementing partners are developing strategies on how to address the spread of HIV and AIDS in the state. Samuel Timatio Bandasi, HIV and AIDS and tuberculosis coordinator in the state's Ministry of Health, says HIV prevalence in the state is 6.5% according to a 2023 survey carried out by Intra-Health Organization.
The prevalence of HIV in the state, according to the assessment, is that Western Equatoria, from the highest that used to be 7.2 previous ANC sentinel surveillance which was conducted. Another one was conducted in 2023. I took from one of the partners, Intra-Health, who is able to reveal those data. They told us we are at 5.6. This is a result of ANC sentinel surveillance conducted in 2003. So another one of recently has been conducted, but yet it's under process for it to be out, for a result to be out.
Michael Waure lives with HIV and AIDS. Waure stresses the need for men to go to clinics for HIV and AIDS tests in order to know their HIV status. He says some men ignore HIV and AIDS testing facilities in Yambio County and only send their wives to get tested.
Since 2006 up to date, I'm now 21 years on the drug. I'm married. I have 2 men. And I've seen 6 children, 3 ladies, 3 boys. I'm living okay. I'm open. I'm not hiding myself. There are so many benefits when you are open. Like me. When you are open, you will be living free. Even your drug, you will be taking your drug among people. Even you will be expressing yourself among people. And your family will be strong.
Waure says people living with HIV and AIDS do not have to hide from the public. Western Equatoria State resident Cecilia Andrew was put on HIV and AIDS drugs in 2008. She encourages people to accept their status who test positive for HIV and says they should be advocates for creating awareness about the disease.
I started taking my drugs in 2008. I have not fallen sick, not for once. I'm very fine, producing my children very healthy. And that is why I'm saying that go for HIV test when you are still very strong before you fall sick. It does not mean your life is finished when you have the virus. Someone's life is in God's hand. You need to calm down and follow what the doctors are telling you. When you get a man, be open. Tell the man you are on your drug. If he is also on his drug, if he accepts you, it's fine, but if not, allow him to look for another woman.
World Health Organization officials in the Western Equatoria State capital Yambio declined to comment on the HIV and AIDS prevalence in the state, saying they are not mandated to speak to the media. Earlier this month, the U.S. government announced it would donate $42 million to support South Sudan's fight against HIV and AIDS. The funds will be dispensed towards the treatment and prevention of the virus. The U.S. has encouraged the transitional government of national unity to use public funds to strengthen the country's health system. On World AIDS Day, December 1st, the U.S. Embassy in Juba said thousands of people living with HIV in South Sudan with their families and communities bearing the burden of the disease. For VOA News, I am Matia Samuel Timatio, reporting from Western Equatoria State Capital, Yambio.